Bad news is any news that adversely and seriously affects an individual's view of their own future. And situations where bad news has to be broken include cancer, the birth of a malformed baby, the death of a loved one, any terminal illness. There are 5 different models about breaking bad news. The first one is the biopsychosocial model, then the individualized disclosure model, the full disclosure model, the paternalistic disclosure model, the non-disclosure model. The biopsychosocial model is the best model for breaking bad news because it has the least number of limitations. It provides evidence-based information and delivers the information according to the needs of the patient. It avoids giving that information to the patient that they've not asked for. So in this model, we use the principles of effective communication, counseling, and also informational care. The first step is seeding and setting. The first point is exclusivity, which means that this bad news must be broken, obviously, in a private setting. The second is the involvement of significant others like family members or friends, which the patient prefers that are with them when the bad news is broken. The seating arrangement should be such that the distance between the patient and the doctor is a distance of an arm's length. The doctor should be attentive and calm and maintain reasonable eye contact. And if the patient starts to cry, the doctor should shift their gaze. And all of this should be done with sensitivity. The doctor should use silence and should repeat the last few words that the patient has said to show that he's been listening well. The doctor should also give a clear indication to the patient of the time constraint, but should make himself available for the patient's queries and doubts. Step 2 is the patient's perception, and here we ask what they know. For example, what do you already know about your condition or your disease? Basically, it helps to assess the gap between the patient's expectations and the actual medical condition. Step 3 is invitation. Here we ask the patient what they would like to know, because we shouldn't assume that a patient wants to know every single thing about their illness. For instance, we can ask, how much information would you like me to give you about your diagnosis and treatment? Step 4 is knowledge, and here we're actually breaking the bad news. So we have to start with something like, unfortunately, I have some bad news for you. Use a language that the patient can understand and avoid scientific language. Use simple language. The information should be given in small bits, and the doctor should ask whether the patient understood what the doctor has said. For example, saying, do you understand what I said? Or is this making sense? Next, we have to ask the patient what they understood. Step 5 is empathy. When a doctor has to show empathy, basically he has to listen and identify the emotions that the patient is experiencing and acknowledge those emotions and show that the doctor understands those emotions. For example, by saying, I would have felt the same if I was in your situation. Step 6 is summarizing. Here the doctor just has to summarize what information was communicated. Step 7 is plan of action. Here the doctor communicates what the next plan should be.